I wish to invite Dr. Durgaprasad from Dauber to present his session. Last 25 years, I'm supporting Dauber. I trust their quality. And Brother Shiva is in touch with us for almost 25 years. We are honored by your presence, Dr. Durgaprasad. We will work together, make a lot of wonders together. Thank you. The dais is yours.
Respected audience, respected dignitaries on the dais and off the dais, I welcome you all on behalf of Dauber India Limited. I am Dr. Durgaprasad. I am representing Dauber India on the quality assurance and marketing of Ayurvedic medicines. So today, I would like to briefly share you with my experiences or my understanding in Ayurveda, why we are using Swarna Bhasma, what are the use of Swarna Bhasma, and with Swarna Bhasma in lifestyle conditions. I have taken a case of osteoarthritis. In osteoarthritis, we have a product. What is the product and how we have done the research on this product, I would like to share with you all. So, in Ayurveda, Rashastra, I hope the same theory works in Siddha also. In Rashastra, we use Parada, mercury as a main ingredient. The importance of mercury itself is Sutam Shatakoti Gunascha Hirakam. Hiraka means the diamond. Sutam means Parad. Mercury has more than 100 crores times potential or beneficial effects than the diamond. So it's very useful in our lifestyle conditions and in the medicinal purpose. So this is a chart which I keep sharing with you, with most of the people. In Ayurveda, there are the various minerals and metals which are correlated with our astrology also. Like Surya Graha is correlated with the Tamra Bhasma. Chandra is related with the Rajata Bhasma. So we all do practice also whenever there is a behavioral disturbance. Everyone says there is the moon effect is there. So whenever there is a behavioral disturbances or hyper-irritation, we keep recommending Rajata Bhasma. Similarly, if you go to the down, Shukra Graha or the reproductive tissues. If there are any problems with the reproductive tissues, we keep recommending the Vanga Bhasma. So similarly, there is a clear correlation between the Vedas and the minerals and the Rashastra. We should understand this as a holistic. Rashastra is a part of the entire system where Upanishad, Veda, Ayurveda and Rashastra all are correlated in a beautiful way. This is again one important chart. Ayurveda believes Sarvada Sarvabhavanam Samanyam Vruddhikaranam. This means whatever there is in the universe, the same thing is in our body. If there are any imbalance in those elements, that cause a disease. See here, our body also contains all these minerals in the macro content. Like we have oxygen, carbon, hydrogen. So we have oxygen, carbon, everything. Similarly, there are micro minerals also. You can see here, our body has iron, fluoride, zinc. If you go to the last, our body also has gold and silver in very micro content. So these micro minerals, they play an important role in our body and their imbalance creates a lot of disturbances. So when we are giving whether it is Swarna Bhasma, Rajata Bhasma or Loha Bhasma, actually we are maintaining the balance of these micro minerals as per the Rashastra. See the beauty of Swarna Bhasma. Why we use Swarna Bhasma in our medicines? I have just taken two book references. As per the Rasratna Samuchaya, Swarna Bhasma is Ayush Karam, Lakshmi Karakam, Prabhakaram, Dhikaram, Smritikaram, Akhila Vyadhiharam, Punyam, Bhutaveshi Prashanti, Smarabhara Sukadam, Saukhyam, Pushti Prakashi. Similarly, as per the Rastarangini, it is Vrishyam, Hrudyam, Netram, Medhyam, Rasayanam, Pumsavanupyogi Vishapaham Kantikaram. Now you understand the beauty of Swarna Bhasma. The Swarna Prashan, which we give for the young children, the newborn babies, that has all these benefits for which we are giving Swarna Prashan or the Swarna Bhasma. The one important thing which I would like to take you to is, this is Akhila Vyadhi Vidvamsi. What is Akhila Vyadhi Vidvamsi? Akhila Vyadhi Vidvamsi means that is the most potent antioxidant. That's the reason why we give Swarna Bhasma in most of the lifestyle conditions. The name itself says Akhila Vyadhi. It's good for every disease. Why it is good for every disease? Because it has a strong antioxidant property. It can be given to any of the conditions where it will provide immediate effect. Recently, if you know, 4 years back, when COVID has come, many of the Ayurveda practitioners or the Siddha practitioners, they have given gold preparations to revive their patients. Somebody used Jaimangal Ras, somebody used Trailokachintamani Ras, Vrihat Vangeshwaras, etc. It's because of the gold content, gold preparations, the patients have survived the viral effect. And it's antiviral also. Bhutavesh Prashanti. Bhutavesh means antiviral. So this is a very beautiful ingredient we have in Rashastra. That's the reason why we use Swarna Bhasma in most of the lifestyle conditions. Now coming to Dabur, what kind of Swarna we are using? Swarna should be always, there are Grahya Lakshanas, Agrahya Lakshanas. As per the Rasratna Samuchaya, the Swarna, the gold bar, should be having some characteristics. Those characteristics actually meet with our 24 karat gold, which means gold should be 99% pure minimum. It should not have any contamination with arsenic, lead, copper and iron, because they don't have the therapeutic benefits. In the market, if you see, there are broadly 3 varieties of gold we find. 16 karat, 18 karat, 22 karat and 24 karat. But for the therapeutic purposes, it is the only 24 karat gold which is useful. The rest of the gold, 22 karat or 18 karat gold, they are good for the ornamental purpose because they contain some other elements which we don't want as the Swarna Bhasma. If you are giving Swarna Bhasma as a medicine to a patient, it should be 100% Swarna Bhasma, which should be 99.5% pure. So what we are doing at Dabur is, this is our purchase record. We procure 24 karat gold biscuits. From those biscuits, we prepare Swarna Bhasma. This is the purity chart which shows the gold specification should be more than 99% pure, and our gold, what we are using is 99.7% purity. That means the raw material we are using is a standard one. After that, there is a process. So when we speak in the pharmaceutical industry, I am from Dabur India Limited. When we see the pharmaceutical industry, standardization means raw material standardization, process standardization, then product standardization. You cannot have a good raw material and bypass the quality, bypass the process. And you have a good process and ignore the FG, finished product. You can't do that because you are into healthcare. You are treating the patients. Your patient is the most important. So once we take the raw material, we go for the process. See, once we did the Swarna Bhasma, today most of the practitioners usually hesitate to practice the mineral preparations, gold items, because they wonder the safety or they hesitate to prepare the safety. So first of all, after the preparation of Swarna Bhasma, we conducted the safety trial. The acute safety profile of Swarna Bhasma, you can see the 14-day study period. During the 14-day period, there was any side effect from any of the organs. All the 100% survival throughout the 14 days in the experimental period. That means when we prepare bhasmas, we do the tests. Varita, Nirutikaran, Apunarbhava, Rekha Punata, etc. Those tests are the physical parameters, but in the chemical also we do test for the safety and toxicity. So once the bhasma is prepared, when we test in the experimental animals, for all the 14 days at the highest dose, all the animals have survived. That means the bhasma is prepared properly, that can be used for the therapeutic for the human consumption. And there is also one more fear that this Swarna Bhasma, because of the heavy metal, because there is a metal, it might cause kidney toxicity or liver toxicity, creatinine levels might go havoc. But we have studied here also, you can see the reports, the SGOT level, SGPT level, creatinine levels and blood urea, they are comparable to normal in the 14-day period, in the acute toxicity period at the highest dose. That means in the normal dose, what we give is 8 milligrams. Swarna Bhasma normal dose is 8 milligrams. And the 8 milligrams dose, this is absolutely safe, that can be given very safely to your consumers. Then I mentioned it is Akhila Vyadhi Vidvamsi. It can be given to any disease. Why? Because it has the strongest antioxidant property. That also we studied scientifically. In our body, there are two enzymes, serum oxidase dismutase and catalase. These are the two enzymes which arrest the free radicals, and they have the very strong antioxidant. That doesn't promote the aggressive any disease. So when we did the Swarna Bhasma for 4 weeks, 1 month treatment, Swarna Bhasma is improving the serum oxidase dismutase levels, SOD and catalase levels, both in serum and in the liver case. That means Swarna Bhasma can exhibit a strong antioxidant property. That's the reason we combine Swarna Bhasma with any of the other medicines. This is one more important process. Usually when we prepare Bhasmas, we do the putas, 7 putas, 14 putas, 21 putas, 100 putas, Sahasra putas. The objective of putas is, one, everyone knows, to reduce the particle size. The moment you triturate, the particle size reduces. The second thing is that when you are doing the putas, the surface area and the structure of the molecule also gets into the finer form. So there is a reduction in the particle size. The structure of the particle also gets into the more homogeneous. So we did a research whereby doing the putas, whereby doing the 14 putas, 21 putas, the Swarna Bhasma particle size has been reduced dramatically. At the same time, the structure of the molecule is more homogeneous. The more homogeneous, the more absorption. The more absorption, the more efficacy. Heterogeneous molecules of the Bhasmas doesn't get absorbed in the body. So this is the simple principle of the Rashastra which we must administer and we must admire. So here is the one property which we have done. In Ayurveda, we have a principle. Whenever we are doing any Bhasmas, always we should take Hingula or Kajali as a medium. Lohanam Maranam Sreshtam Sarvesham Rasabhasmana. When we did the Swarna Bhasma with mercury as a base, we get the 98% of the gold. But when we do with any other medium, we don't get so much yield. See, when we did the same Swarna Bhasma with iron as a medium, we didn't get more than 50% of the Swarna Bhasma, and rest every percent is iron, copper, etc. So that's the reason why we have been studied, or we studied that Lohana Maranam Sreshtam Sarvesham Rasabhasmana. So this is what I am saying. This is the electron microscopic image of Swarna Bhasma after 21 putas, which shows the particle size is reduced between 3 nanomicromilligrams to 6 nanomicromilligrams, and the particles are more homogeneous. If they are more homogeneous, you will get a better result in your preparations. Now I'll just briefly tell about Swarna Gugulu. Swarna Gugulu is a Dabur product for osteoarthritis, which can be correlated with the Sandhivata as per Amvata, as per Ayurveda. Why osteoarthritis? Because of today the sedentary lifestyle habits and Vidyahar Vihar, the osteoarthritis, obese people are getting more osteoarthritis. This is the 4th leading cause of disability in the world. These are the key joints or the key areas where osteoarthritis gets affected. I'm just showing you how the physiology changes in the normal joint and the osteoarthritis. So the cartilage disturbs and the synovial fluid escapes, because we call osteoarthritis also as a degenerative arthritis. During the degeneration, cartilage tears away and most of the synovial fluid escapes, and there is a friction between the joints which causes a lot of pain. So Swarna Gugulu is a combination of Swarna Bhasma, Mahayogaraj Gugulu, Ashwagandha and Keshar. As you know, Gugulu, we studied about the Gugulu preparations. Gugulu everyone knows as the Vatahara, Kafahara or the anti-inflammatory, and there is a very good research also conducted. Gugulu sterones, they are the inhibitors of nuclear factor which signals the anti-inflammatory pathway. That's the reason how Gugulu acts as an anti-inflammatory and analgesic activity. Ashwagandha also reduces inflammatory markers like cytokines, tumor necrosis factors alpha, which is a protein which aggravates the inflammatory pathway. So that's the reason, as per Ayurveda also, again, Sandhi Shotahara, Shotahara, Vatahara, Kafahara. The same thing is proved even in the scientific studies. Ashwagandha significantly reduces the inflammatory markers. That's the reason why it is reducing the inflammation and the pain. Coming to Kesar, most of the people believe that Kesar is a very good nervine tonic. But Kesar is also very good anti-inflammatory, analgesic, and it also maintains the cellular integrity. As I mentioned in osteoarthritis, the joints and the cartilage gets disturbed. But using the Kesar, it maintains the integrity and facilitates the movement. So it inhibits the production of pro-inflammatory molecules and because of its anti-inflammatory property and analgesic. So we conducted the clinical studies with the Swarna in osteoarthritic patients. I'll just quickly run through. I already received the note to conclude. So Swarna also resulted in considerable inhibition of production of LPS-induced pro-inflammatory mediators like TNF-alpha, MIP-alpha, IL. Down-regulation of these levels with the pro-inflammatory mediators has induced with the Swarna reduces the inflammation significantly, giving the significant relief in osteoarthritic patients. Thank you very much.
Thank you, sir, for your presentation. I now request Dr. Shivakumar to felicitate our company presenter.
So as a practitioner, I've been using Dabur products for more than 15 years, and my father is a Siddha practitioner. Though he is a Siddha practitioner, we use a lot of Ayurvedic medicines, and father uses Dabur products for more than 40 years. So we were discussing about many products in the previous meets also. Thanks for this wonderful presentation, sir. We came to know about Dabur more. Thank you.